You're watching CTOM TV. Knowledge is power.
Okay, Zach's wondering, what questions should I ask my after being diagnosed with cancer?
Well, every cancer is going to be different.
Mm-hmm.
The first thing you want to ask your doctor is, what are my survival rates?
Okay.
What are my overall survival rates, response rates, and progression-free survival rates with the treatment that you're offering?
Yeah.
And number two, show me some peer-reviewed data to back that up.
Mm-hmm. Well, okay. So first of all, find out basically okay, doc, if you're going to give me this treatment, what does it mean in terms of how long I'm going to survive? Probably. Is that what you're saying?
Yes.
Get that
exactly.
off the
And your
table right
response
away.
rate to specific drugs.
Right. And how likely is it I'm going to respond to this treatment?
Mm-hmm.
Okay. One thing that I feel is important to add to that is depending on where you live, depending on the country in which you live and the types of healthcare system in which you live, and how much money you have, frankly, and the type of doctor that you're able to see, certain doctors will only be able to offer you certain treatments. So it's important that one of the questions that you ask is, what else is possible? You might only be able to offer me this or that, but like, what else is out there? And it's also important that you know that there are so many options for like so often people are offered, that there's a type of chemotherapy that they're offered, or a type of radiation, maybe some surgery, and that's kind of the standard for that type of cancer, which still in many systems is diagnosed based on location and not mutation, which is a big problem. So a question that I would say you want to ask your doctor is, what kind of genetic testing are you going to get for me? What kind of diagnostics are?
That's a great point. Yeah.
Yeah. Like, because you want to hear something like, we're going to get you a broad panel genetic test that looks at least 300 mutations, not, well, we'll test and see if you have this one mutation that's common in that type of cancer. You're probably not going to hear that, by the way, but you do want to hear that. In the US, it's far more prevalent, those types of tests.
Yes, they are.
Mm-hmm. And not so much in Canada. The UK is increasingly using genetic testing as part of its standard diagnostic process. In case you don't know, Canada is about 23rd in the world for cancer care, give or take. Yeah, those are the latest studies.
But it is free.
But it is free. But the point, the reason I'm saying that is we are very fortunate in Canada here, as with other countries that have public health care. There's lots of perks to that. But you must remember that the downside is that you're not going to be getting the most current treatment or the most current diagnostics. That's kind of the price we pay for having this public healthcare system. In the United States, for all the stuff we hear about insurance coverage and how expensive it is, and so many people without any sort of healthcare, which of course is awful, those that do have healthcare almost always will have a good genetic test these days. Doctors in the US just seem to understand the value of that a little more rapidly than in other countries.
Yeah, well, there's a lot more funding there too.
Yeah.
For that sort of thing.
So something I wanted to add to that question, even though it was asked of Alex, but it's something that's kind of my wheelhouse here, is that we do have about a 3-page PDF that we created, because we get this question a lot about, what questions should I ask my oncologist? How do I know I'm getting the best treatment? What are the most important things for me to do? So my team and I created a PDF with all the things that you want to make sure, all the boxes you want to make sure your doctor's going to tick for you. And just questions that help your doctor to understand that you are an educated consumer and you know what's possible and you want the best that they can provide for you. So if you'd like that PDF, you can just message us in the comments below. And we'll be happy to send that to you.
And it's an excellent PDF. I've looked over it, and it's just wonderful.
Thank you. We tried to cover all the bases, that's for sure.
You did a great job.
Thank you.
Thank you for watching CTOM TV. Subscribe below and stay informed.